Welcome back. In your health news, a cough is a normal response to throat irritation, but it can be triggered for different reasons like viruses, allergies, lung infections, maybe acid reflux as well. As you can imagine, this time of the year, coughs are more common, but treatment, now that depends on the cause and the diagnosis. Our medical expert, Dr. David Winter, joins us to truly discuss how to treat a cough and when we need to seek medical attention. Thank you so much for joining us.
Good, Cleo. Good to be with you.
Glad to have you. You know, when patients call you with complaints of a cough, what do you ask them to help you understand the cause and maybe how to treat them as well?
Yeah, that's the whole goal. Try to figure out what the cough is coming from. So we ask them, when did it start? How bad is your cough? Does it keep you awake at night? Are you coughing up a lot of stuff? If you are, is it colored? Clear, green, yellow? Do you have a lot of congestion, nasal stuffiness, postnasal drip, indigestion? All those things can help us get some kind of clue what it might be. And when they come in the office, we get even more clues by the examination, Cleo.
Right, that's what I'm thinking. What do you look for in this examination?
Well, you first kind of look at them. Do they look pale? Are they kind of weak looking, sweaty, short of breath? That's a big clue. Press around on their sinuses, see if they're tender there. Look up in the nose, look at the throat, see if it's red. And then the breathing is a big thing. If they're really working hard to breathe, using their neck muscles and shoulder muscles, that's a clue. You listen for rales in the lungs, that's crackles in the lungs, press on their stomach. All these things to try to figure out, do they need to be hospitalized? Can they get better with antibiotics? Or over-the-counter medications, would they work for them?
Dr. Winter, what about over-the-counter non-prescription remedies like you just mentioned? What do you recommend?
Yeah, often cough drops, cough syrup can really help to tone down that cough. You want to also use antihistamines, decongestants if you're stuffy. Nasal sprays can also help with that. Antacids if you have a lot of reflux, those can help. But sometimes that cough just keeps going, so coughs can be a real problem, Cleo.
Yeah, Dr. Winter, when those coughs do linger, lasting maybe several weeks or more, I feel like I've had a dry cough for a couple months now. What do you recommend?
You know, when people get sick with a cold or have a short-term illness, usually the cough goes away in a week or two. If it lingers longer than that, though, you get into this cycle. So you have irritation in your throat from a virus, from allergies, whatever, that makes you cough. The cough irritates your bronchial tube. So you get in this cycle. You got to calm that down. Some people think if I just cough it all up, I'll get well quicker. Not true. It'll go away on its own. Reduce that cough if you can. If you can't on your own, there are prescription cough medicines. We sometimes use steroid shots to get rid of it. So coughs come from different sources, different causes. Find out the cause of it, and then we can find out the treatment.
Dr. Winter, and before we go here, I know I said that before, but we've got a little bit more time, and I just want to ask you one question that I'm seeing from people that are watching now. I guess, when do you recommend that someone maybe do a teledoc visit or something like that for that cough?
I think it's always worthwhile. You know, if you have mild symptoms that look like you got those from your kid or from a neighbor and they're pretty mild for the first 2 or 3 days, you probably don't need to talk to a doctor. But if you're unclear about that, if you're immunosuppressed, some of the elderly folks in particular, they need to check it out. Teleconference is good. Call your doctor on the phone or go see your doctor. That can also help.
All right. Dr. Winter, thank you so much for your time and your insight. Thank you for joining us here on Midday.
You bet. Good to see you, Cleo.
All right. Nice to see you, too.